Awesome. Well, thanks everyone for joining. This is the COVAC Town Hall on the effects of the pandemic on mental health for healthcare providers and students and anyone else who might not fall into those categories. I'm pretty sure it'll be an applicable discussion for all. Yeah, so I really appreciate you guys joining. Today we have 3 mental health experts with us. So we have Megan Fix, Sejal Shah, and Sandra Mattar. They're right over here at the top, if you can see them there. And so I'm just going to let them quickly introduce themselves before we kick off. It's going to be an open Q&A, so I'll start off with a few questions, and then as you have them, please feel free to put some questions in the chat, and we'll make sure we're monitoring that, and we'll make sure we get those questions answered for you. So anything that you have about how you can prosper during this pandemic, it's a really difficult time for everyone. So no, nothing is off limits. So please feel free to put questions in the chat as you go. So Megan, I'll kick it off with you if you don't mind quickly introducing yourself.
Absolutely. Thanks so much, Sophie. And thanks to everybody for being here during a really challenging time, but happy 2021. And hopefully things are looking up, or at least I believe that they are. So my name's Megan Fix. I'm an emergency medicine physician. I actually know Krithi from way back when in residency. And right now I am an associate professor at the University of Utah in Salt Lake City. My main interests in medicine are obviously emergency medicine. I love being an emergency medicine physician, and we've dealt with a lot of COVID, so I'll be happy to answer questions about that as we go on. But I also really have an interest in physician wellness, and that stemmed from my own personal experience when I was a resident. And I'll share more throughout the panel discussion, but briefly, I had a very serious time with depression when I was a second-year resident, and it was quite severe. It was the darkest time in my life, and I really gained a lot of support from people like Krithi, Dr. Bhatia, who really helped me out as a friend, but also as one of my colleagues. And since that time, I am a huge proponent of people getting mental health services wherever they are in life, including the help of Dr. Shah and Mattar, who we'll talk later on. But I really believe in therapy and working with each other to try and get our colleagues, our friends, our family the help that we need, because I've really benefited from that. And I haven't really looked back. I've not been in that place again, but I feel very strongly that it's important to help each other out when we are struggling with mental health needs. So thanks for having me on the panel.
Yeah, thanks so much, Megan. I really appreciate it. And as someone who's also struggled with mental health, you know, I think it's a fairly ubiquitous issue, especially now, you know, when we're all locked up and crazy. So it's great to have that insight as well. So thanks for joining. And Sejal, would you like to introduce yourself?
Absolutely. Thanks so much, Sophie and Krithi, and Megan, thanks for kicking this off with introductions. I'm also really excited and honored to be here on this panel today, and thank you everybody for coming. So my name's Sejal Shah. I'm a psychiatrist at Brigham and Women's Hospital in Boston, where I am the division director for consultation liaison psychiatry. And so I see patients in the emergency room as well as the medical surgical floors, really patients that are both suffering from primary psychiatric issues as well as just behavioral symptoms related to medical illness as well. And I also am a program director for a medical fellowship also in consultation liaison psychiatry. And so I love working in medical education and just education in general. Also have an interest in physician wellness, as Dr. Fix does, and have during this pandemic have really taken kind of an interest in working on psychological support for friends, for colleagues, as well as kind of supporting my hospital system in managing this pandemic. I have also seen COVID patients that are, suffering from psychiatric illness at kind of a disproportionate amount, and so can also speak to that during the conversation today. But thank you so much for having me, and thank you to everybody for joining.
Awesome. Thank you so much, Sejal. Looking forward to hearing your perspective on things. All right, and we have one more panelist. Sandra, would you like to introduce yourself, please?
Sure. Hello, everyone. Thank you, Sophie, and thank you, COVAC, for inviting me and creating spaces like this to talk about that and to share our experiences. So I'm a clinical psychologist that works at Boston Medical Center, I'm an assistant professor at the Boston University School of Medicine. I also see patients at this Boston Center for Refugee Health and Human Rights. And so work a lot with refugees, but I'm also supervising a lot of doctoral students and residents at the hospital. So I mainly, and I'm also trauma psychology is my specialty. I teach also courses in trauma psychology and disaster mental health, COVID being a disaster. So, and I've seen the impact on students and my, but also obviously my patients, who many of them are frontline workers. So. Yeah, and I'm happy to share. Yeah.
Yeah, thank you so much, Sandra. It sounds like it'll be very interesting to hear what you have to say. It's definitely a traumatic moment, I think, for all of us right now. So really excited to have you. Yeah, thank you all so much. So I think we're ready to go. I'll kick off the Q&A with a few questions. And then, as I said, please feel free to put your questions in the chat, or if you want to come off mute and say any questions there, totally fine with that as well. And so I think one question kind of on the top of our brains for everyone in terms of mental health in the pandemic is, what can I do to take care of my family and friends who may be struggling during this time, whether they're struggling with isolation and not seeing their friends? What are some things that we could do for that? And I'll start with you, Megan, if you don't mind.
Sure. Yeah. Thank you so much, Sophie. I have an interest in this because of something about my experience. So if it's okay with you, my main point is listen with intention. And I'll tell you a little story that goes back to when I was really struggling and what helped me, just to identify and to give you an example. So when I was a second-year resident, I was really, really depressed. I was actually at the point that I was suicidal. And I was biking in between the Brigham and Mass General because I lived in the middle of those two hospitals in Boston. And one of these days that I had just been feeling so terrible and so depressed, and I didn't feel like I could reach out to anybody. I felt like everybody else had it all figured out. And, as a resident, as a doctor, you're supposed to be on top of it and, not show any weakness, right? That's what I thought. So I was showing all this strength, I thought, on the outside, but on the inside, I was just terrible, struggling. It was just awful. And so one of these days I biked to work, and I had been crying because I had been thinking about biking into oncoming traffic during this commute. And I saw Krithi. Krithi was right here, and she saw me, and I was kind of wiping away tears, and she had already been there. She's like, "Hey, Fixie, how are you?" And I said, "Oh, fine, I'm fine. Let's get ready for the shift." And then, you guys, this changed my life, and I might start crying because it really was a moment where I realized the importance of human connection. So she looked in my eyes and she grabbed my arm and she said, "No, really, Fixie, how are you?" And that's what I mean by listening by intention. So often we see each other and we'll say, "Hey, how are you?" "Great, fine. Let's move on. Let's get to our day." But Krithi actually looked into me, looked into my soul, and knew that I was struggling. And she took the time to actually make it important that we stop and talk about it. So that is my most important point, to take care of each other, because you can tell when someone has been struggling, or they seem off, or they seem upset. Take the time to say, "No, really, how are you?" Because once she said that to me, I felt that she cared about me. I knew that I could talk to her about it, and all of the floodgates opened, and I was able to actually tell her how terrible I had been feeling. And she helped me talk to our program director and get in touch with EAP so that I could get a therapist. And it was just, I kid you not, it's changed my life. I mean, that was what, 18 years ago, Krithi? And still, I really want to just express that, that really listening with intention to each other can be life-saving. So do that.
No, definitely. Thanks so much. And I totally agree. Sometimes it just takes one person to really ask that question and see what's going on. Sejal or Sandra, do you guys have anything that you'd like to add?
Yeah, I would just emphasize what Megan said. I think, you know, listening with intention and validating emotions. I think a lot of times we are so reluctant to talk about the emotions that we're experiencing because we think that we're the only ones, or we think that we're not supposed to be feeling a certain way. I think that's true in healthcare. I think that's true outside of healthcare. I think society makes us, you know, perhaps question whether it's okay to experience certain emotions. And especially during this time of the pandemic, you know, we might be experiencing multiple emotions at once and feeling like we don't have the permission to feel certain emotions, like, you know, boredom or indifference. You know, that sadness is okay and frustration is okay and anger might even be okay. But it's okay to feel all of those emotions all at once, or cycle from one emotion to another, and letting, you know, your friends and family, and also creating that space for yourself and self-compassion to let yourself experience all of those emotions. But really for others, for friends and family that might be struggling, you know, letting them know that it's okay that they're experiencing those emotions, and asking, you know, what can I do to help? Not can I help, but what can I do? And really just, and like Megan said, then, you know, listening to that answer with intention.
Yeah, and I'd like to add normalize the idea of reaching out. It's okay to reach out. And you mentioned, Sejal, you mentioned the idea of self-compassion. I've been working a lot with my students on self-compassion, also on myself, because the truth is that we're going through a disaster and a pandemic where we're all involved. That is very rare in history, really, unless you're in a war and in a city. I mean, where the whole country is involved, that's very rare. And when wars happen, only certain cities are involved, but not the whole country. So as I supervise and as I teach, I try to normalize. I try to share what I'm feeling, and I try to normalize many things. And I open up in ways that I never opened up as a professor or as a teacher, as a supervisor, expressing some sort of vulnerability so that people can feel free to open up.
Yeah, no, absolutely. No, I totally agree. Yeah, everyone needs to feel comfortable, you know, speaking your emotions and saying what's on your mind. So it's hugely important. I have another question. I think Sandra, I'm going to start with you for this one. What do you do when a loved one, a friend, family, a coworker has passed away in the middle of a pandemic? What is your advice for that?
Well, you know, that the way that we're grieving now is very different. So it's sort of a disenfranchised grief, right? That you're not fully able to grieve because you have not gone through all the regular cultural processes that we go through when we lose someone. So I put a lot of emphasis, and I mentioned this to my students, on helping the person to create ceremonies to grieve. To get some sort of closure. It's very hard. It's a very traumatic sort of death. If not creating spaces for closure, then that can turn into disenfranchised grief, which is really, that's something that can be transferred from one generation to another if we don't take care of it. So creating spaces to do formal grieving processes based on your cultural background, or if you don't have necessarily a religion, but everyone has a culture, right? You don't necessarily have to be a religious person. There's always ways to create closure here. Yeah.
Mm-hmm. Absolutely, yeah. And speaking from someone who has also lost, you know, I lost one of my grandparents during the pandemic. It was definitely strange, you know, attending a funeral where you can't really hug people and everyone's in masks. So it's definitely challenging. And I agree, you know, creating that space for everyone was helpful, definitely, to at least be there for everyone. Mm-hmm. Megan and Sejal, if you have anything to add, as always, feel free to jump in. No need to wait for me, but I can also move on too. So Sejal, we'll start with you for this one. So there's a lot of obviously horrifying information every day, as you know, we have rising cases, rising hospitalizations, rising deaths, and it doesn't seem to be stopping. Do you have any suggestions for dealing with that information? What do you think is a good coping mechanism for that?
Yeah, Sophie, it's a great question, and I think it's as Sandra mentioned, you know, it's rare for the entire globe to be focused on one issue, and in certain ways, you know, that can be somewhat comforting and knowing that other people are going through something, you know, a similar experience. But in other ways, it's really all that we hear all the time. And given our 24/7 news cycle and social media, it's really, really hard to get away from it. And so, you know, the advice that I give with this is limit the amount of news that you take in. You know, we know what is on the news, and it is often helpful to keep ourselves informed. And I think, you know, we live in a society where being informed is very, can be helpful in certain ways and also helps us connect to other people. But because, you know, it's hard to avoid, it can be traumatic in itself, you know, that when you see traumatic events on, even when it's on television and you're not, you know, physically at a hospital or in a war zone, we know through research that can also be quite traumatic. And so, you know, really limiting the amount of time that you're spending on social media, the amount of time that you're watching the news, and, you know, to say that you can turn it off completely is probably unrealistic, but perhaps setting aside 1 or 2 times during the day where you're spending maybe 5 or 10 minutes really kind of taking in news and updating yourself and making sure that you're informed can be very helpful. And then during those other times, really kind of unplugging, perhaps not completely, but at least a little bit, to be able to get away from some of the traumatic events and news that is kind of out there. I think what's also really important here is acknowledging the emotions that you might experience related to taking in that information. And again, you know, feeling things like anger or frustration are normal, but it's also normal to feel numb, feel that numbness and indifference after a while, and not feeling, you know, like you're a bad person because of that. And then the last thing I'll say is that a routine is really important. I think during a time when everything feels upended, and things just feel kind of that nothing is, quote, normal, really creating a routine for yourself can be really, really, really helpful, such as, you know, getting up and going to sleep at similar times each day. Even if you're, you know, working from home or not leaving the house as much, you know, doing things during your day in a somewhat kind of routine might be helpful. Doing, you know, something that you enjoy every day. Also, you know, movement can be really, really helpful, you know, for those of us that live in cold weather climates that can't always happen outside during these months, but it can happen in your own house, even when it's 5 or 10 minutes of even stretching can be really helpful.
Yeah, no, absolutely. I think unplugging was a huge thing for me during this pandemic. It's really hard when the phone's constantly pinging, you know, and you just can't seem to get away, but putting that down has been very helpful for me, at least, too. Yeah, thank you. So Megan, I'll send this. You want to jump in? Feel free. I
wanted to just piggyback off of Sejal's comment, because I thought what she said was so profound. And one thing that I've done, because I work in the emergency department, I see a lot of COVID every day when I'm working COVID pod shifts. And I've tried to really, on my way home, so on my drive home, I've been trying to practice the 3 things of gratitude, which I used to just write down every day, which I really think is just a great practice at any time in your life. And I would just like leave this really stressful situation and just think about on my drive home these 3 things that I'm grateful for. And that helped me kind of like shift from the numbers and negative to really thinking, gosh, you know, I have an amazing family. My husband and my kids are healthy, and I'm healthy, and I have a job, and I'm doing good work. Like those type of things really help me shift. And I absolutely agree to not immerse yourself in it, because it can be so overwhelming just to be focused on the numbers every day. I don't even like listen really to the numbers anymore, but we have faculty meeting every week, and my director will tell us what's the current situation. So I do think that practicing gratitude has been really helpful. And then I wanted to say one thing. I don't know how many people are in a clinical environment on the call, but because I fortunately have not experienced any deaths of loved ones. So Sophie, I'm really sorry for your grandparents. So I do feel very grateful for that. But I have seen a number of deaths from COVID and other things during the pandemic in the ED. And I've really found it helpful for me to, whenever that happens, to do a moment of silence with the whole team in the room to really identify that every person is a human being. And when they pass, I could just keep thinking about that and thinking about it. But if we take a moment of silence and all talk about this person's name was this, they passed away, let's take a moment of silence to really reflect on them as a person. They had parents, they had loved ones. That's helped me as a clinician during the pandemic really realize that yes, we are fighting this, but these are also human lives that are really meaningful.
Oh, absolutely. Thank you so much. And I think kind of going off that question and your response as well, in terms of, you know, people who are working in the emergency departments, who are at the hospitals with COVID patients every day, I think there's often, you know, obviously that's exhausting for those people. And they're, you know, healthcare workers are working hours, crazy long hours. They're not seeing their family as often as they like to. And I know I've seen it in some of my friends who are nurses who are, you know, expressing how frustrated they are. And they're kind of getting this response of, you know, well, you signed up for this. This is what you wanted to do. You decided to enter this career. What would you suggest for those healthcare workers, how they could kind of respond to that, or also kind of, you know, deal with that emotion of, did I sign up for this? Is this what I wanted?
Yeah, Sophie, that's a great point. And I think the pandemic has brought out a lot of emotions in everybody. And there's been, you know, family struggles and strife. I want to see you, I don't want to see you. And, you know, you signed up for this, you didn't. My own personal feeling is that I have taken comfort in knowing that I do feel what I'm doing is noble, and there's risk to it, but I do feel good about it. But I would say for healthcare workers, one thing that our group really has utilized that has been very helpful is we have a resiliency center at my hospital that has people like Sejal and Sandra. We have a staff psychologist, and we signed her up to run weekly check-ins with all of the doctors and the nurses in separate ones on Zoom. And that was very helpful because it allowed us to air our emotions and talk about what we were feeling. And even though we weren't like seeing each other every day, we were able to connect in a safe space with a psychologist there. So that I found very helpful, because then you can talk with other people in your specific group about how to get through it together. So I found that really, really helpful in terms of the healthcare workers, because we were able to connect, vent a little bit, but also find ways to have support. So if your place of work has a wellness center or a resiliency center, I would really, I know you guys are really busy, Sandra and Sejal right now probably, but having that as a regular session for our group, like people came, it was really, really helpful.
I couldn't stress that more. We also have something very similar where we have a faculty and training mental health program, but during the pandemic, it really is open to, you know, the huddles that are run by the psychiatrists and the psychologists that run that program, created huddles for healthcare providers, particularly those that were on the front lines and of any discipline. And exactly what Megan said, I think it's a really safe space to be able to connect with people that are feeling some of the same emotions and maybe hearing some of the same things from friends, family, from their community about, oh, well, you guys got this. Like, this is what you signed up for. Like, you know, nobody's forcing you to do this. But let's just be clear. This is, you know, word of the year, right? Unprecedented. I know I didn't learn how to manage a pandemic during medical school. I hope moving forward that that is taught in various kind of healthcare fields in school, because I don't think any of us felt prepared for this. And so, you know, I think it's important also to kind of note that, you know, it's that specific person's perhaps discomfort with, you know, everything that's going on. And I think Megan already mentioned, you know, people are experiencing lots of different emotions, both within healthcare and outside of healthcare. And so I think, you know, people tend to say things when they feel uncomfortable. And so, you know, they may not, just like when somebody's going through a difficult time, you know, a friend or a loved one might say something that's insensitive without necessarily meaning it. And so, but I think it's important to think about kind of intention versus kind of outcome. And regardless of what that person's intention was, it's hurtful to hear that as a healthcare provider, like, oh, you know, suck it up, you signed up for this. But it's okay to feel that, no, you know, I didn't sign up for this. And I, you know, and even though I'm in this, I can still feel the various kind of uncomfortable emotions that I'm going through. And you know, as Megan has already alluded to, you know, be proud of the work that you're doing.
Also, I wanted to mention that as a culture, we are, all of us are facing death, really, and that's ongoing. And we're not used in the United States to talk about death. In many cultures, death is part of regular life, right? When I went to Nepal, I would see how the dead people would walk by, and meaning they would carry that person, and then to the whatever they call the cemetery, or where they burn the body, and that's part of regular life. And for us, it's not, and we try to hide it, we try to sanitize it, and so perhaps this is a very painful lesson that we need to relate to death differently, right? That it's we need to accept it's part of life, but obviously it's very painful. So I think that I want to always see the positive aspects of it and how we can develop resilience in this situation. And I think that certainly this is something that will make us more resilient as a country.
Absolutely, definitely, thanks. And sort of speaking about resiliency, I know that a lot of people are trying to kind of, you know, keep a strong face and stay resilient, but, you know, they might be struggling, you know, underneath. And so Sandra, I'm just curious, how do you address a patient, a loved one, a student who you think may be struggling from mental illness? How would you approach that situation?
That are experiencing COVID and struggling with mental, oh, you mean because of COVID they are struggling? Yeah,
excuse me. Yeah, they're perhaps they might be, you know, they could be anxious or depressed because of the situation. How could you go about addressing that with someone?
Well, I can tell you that two students I was supervising, they really developed some mental health issues, and they were very sort of secretive about it, and I requested that we meet on Zoom one-on-one, because I think it's important to intervene when you see something like that happening. They are not fully functioning. You try to have a conversation with them, but then if nothing else happens, then it's important to do one-on-one talks and come clean, basically, about what's happening. And one of my students, an African-American student, was struggling because of her fear of contracting COVID, but also at the same time, there was the Black Lives Matter movement was going on. She felt that she had no protection whatsoever after she saw all these African-American men dying, or the Black, and so she felt completely helpless. So it was a challenge to try to bring together her fear of COVID, her fear of death, but also the very real fear of, she could be that person that was killed on the street. And it was a whole combination of factors. But anyways, what do you do? What do you tell them? I think that it's important always to connect them to help. That's important. I engage a lot in psychoeducation, and explain how why this is happening and what could be happening. And I think that people are pretty open and they are very understanding when you do a little bit of psychoeducation. And because I'm a trauma psychologist, I am very aware of things that happen. This is a state of war. I studied the impact of war on people. And so I bring a lot of that experience into this. I see COVID as a war too. And so talking to them, doing psychoeducation, encouraging them to constantly reach out, and providing resources. It's important to know that the resources are out there. At the clinic where I work, at the refugee clinic, we are providing a lot of resources every week on email blasts to our patients. so that they understand that there are all these resources out there, and try to make it in ways that they understand that sometimes it can be overwhelming, and this is a time when everybody's overwhelmed. So you make it simple for them. Yeah, I don't know what Megan and Sejal recommend. I'm sure you have great ideas to recommend.
I would say a lot of it, actually, you know, I think Megan covered a lot of what I would say for this specific situation with her introduction, which is that, you know, I think checking in with somebody that may be struggling is so important. You know, sometimes even the person themselves may not notice things in themselves that you may notice. And so, you know, noticing changes in behavior or personality, someone may be isolating that you're usually used to connecting with, you know, maybe not in person, but you were used to having a phone call with, or, you know, you did, you know, a virtual happy hour and now you're not doing that anymore. You know, just checking in with that person and saying, you know, is everything okay? I really wanted to check in, and then asking, you know, very specific questions like, how is work going? Or how is it that you're not working? Or how is it managing work and childcare at home? You know, getting a conversation started can often be very helpful to kind of assess how that person is doing, and really helping them understand that you care, and that you're really there for them. That can make the difference. And then also just normalizing mental illness. You know, I think we've alluded to that many times already, but really kind of making it, quote, kind of normal to reach out for help, whether it's reaching out to friends and family or reaching out for professional help. And I think one at a time, we can help tackle that stigma.
Yeah, I absolutely agree with both what Sandra and Sejal have said. And along the lines of normalizing it, as Sejal mentioned, I teach on this with the residents every year, and I say, it's not if, but when. Like, it's when you are going to have a loved one or yourself dealing with mental health. So we really need to be prepared to offer the resources, like Sandra mentioned. And one example that we do with our residents every year to help normalize it, I'll just give you a little vignette about it, is I tell my story, and then we have a little rehearsal role play kind of a thing where there's two residents, and I assign them in advance, and one is pretending to be charting and working on things, and this person says, gosh, I'm just having a really hard time and I might as well just kill myself. So they say that, and then the person next to them, they've been prepped for this, they kind of brush it under the rug and say something like, gosh, you know, we always feel, you know, we're residents, it's hard work, and same in the pandemic, like, this is hard work. Maybe just get some sleep and you'll feel better. So in this vignette, we then have a discussion with the rest of the group saying, you know, what should we do in this situation? And Sejal and Sandra are the experts, so please comment if what I'm saying is incorrect. But my personal feeling is, if someone says something alarming like that, you never want to brush it under the rug. You want to actually hit it head on and say something like, wait a minute, are you really considering hurting yourself? Because I care about you and I want to help you. And so that, like, being able to be okay with the uncomfortableness of something like suicide, or feeling in despair, or feeling like extreme loneliness, and talking about it, and then resources. And in this particular case, what I recommend is what Krithi did for me. She literally took me aside, and we called the program director together, and then he helped me call EAP together, like sitting down together. So if something like that comes up where you think that the person is really in crisis, please don't brush it under the rug. But Sandra and Sejal, I'd love to hear your expertise on this.
Well, I think it's wonderful what you're doing. You're normalizing that kind of behavior, and basically implanting in their brains that, you know, this is not okay if someone makes a comment like that. I think it's wonderful. Yes, we should do more of those trainings.
Yeah, I completely agree. I think, you know, just, you know, it may be a true joke, but also just noting that, you know, sometimes it's not. And so, or it's a marker for something that's going on, that's serious, you know, and just starting that conversation can be really helpful. I love those role plays. That's fantastic.
It is, yeah.
Yeah, no, that sounds like a great way to sort of raise awareness and help people out, for sure. Thank you. So Sejal, I have a question for you about parents. We have a lot of a lot of parents on the line right now, and I think parents are sort of in an unprecedented, our favorite word, an unprecedented situation where they're with their kids constantly, more than ever. And I think one of those challenges is, they can't see their friends, they can't do sports, maybe they're not in their after school activities. How do you have any suggestions for parents who are trying to keep their children happy and engaged and positive during this time?
Yeah, absolutely. I think I'll just start out by saying it's hard. I think nobody is going to pretend that this time is easy for families and particularly, children at ages that can't necessarily fully understand what's going on. We do understand what's going on, and it's difficult for us, just imagining putting ourselves in the shoes of children that can't understand why they can't see their friends, or why they're not going to school, or why they can't play at the park. These are things that are very kind of, they're big for them, and they're big in development. But the next thing I'll say is just, I think the most important thing is really explaining the pandemic and kind of what's going on in terms that they can understand, and being transparent, and kids pick up on things, and they know that things aren't right, even if they're at very young ages. And so really being kind of honest and open, and then asking children, what do you know about what's going on, or what are you afraid of? What are you scared? Mommy's scared. Are you scared? And really kind of normalizing emotions for children as well, and giving them the language of how to talk about things, and saying, I'm frustrated that I can't see my friends, and I know that I've cried because of that. Are you feeling that way? And really kind of helping them develop that language to be able to talk about their emotions, and then validating those feelings. I think it's already validating to say that you're experiencing some of those, but also saying that people that they know and love and trust are also feeling those things, can be really, really helpful. And then on the flip side of that, also knowing that children are resilient, that I think, we have appropriate concern that, our kid's going to be able to bounce back from this. How are we going to be able to manage? But also having, faith in that kids are resilient, and that we can help build that resiliency, a lot of which is done by really kind of validating their emotions, and then keeping them connected to family and friends. Doing phone calls with loved ones, or setting up, FaceTime or Zoom meetings with their friends, can be really helpful. That really kind of depends on what age they're at, of course, but that can be an option. And then going back to kind of what I said before, and sounding like a broken record a little bit, in saying that, routine is not only helpful for adults, but routine is helpful for children as well. And so setting some certainty for them in their lives can be incredibly helpful, but also knowing that this is really, really difficult for parents that are juggling a job or looking for a job, and then childcare as well, particularly for children that are not in daycare or not in in-person school, and really kind of trying to balance those things. But then also that comes back to self-compassion and understanding that we're not going to be able to do everything all at once, and we're not going to be able to do all the things that we want to, and giving yourself permission to say that I'm just not going to get to that today, or the kids are going to have to go without my attention for this period of time, and that's okay.
Yeah. No, definitely. That sounds like a great advice for a lot of the parents on the call, if you're listening, I'm sure. But yeah, no, thank you all so much for that. I want to take some questions from the chat, because I feel like they're very interesting and they're coming in. And they're a lot about healthcare workers, since we have a lot of physicians on the line right now. And I'll start with this one right here. Megan, I'll start with you here. What do you think that the long-lasting psychological effects of this pandemic might be on the healthcare community? And that's from Rebecca Pariente.
Well, Rebecca, thanks for being here, and thanks for asking a question in the chat. That is a really, really interesting one. And I tend to be, especially after my experience I mentioned, very optimistic and kind of a glass half full type of person. So my personal hope is that it makes us more resilient, and it actually makes us more of a community of healthcare workers, because I think that so many of us in the beginning were just completely overwhelmed. We didn't know what to do. We didn't know anything about the disease. We felt very scared. And in my particular case, it really did bring us together as a group, and where we thought, gosh, we need to protect each other, and we need to help each other. And we did things like, we had the older physicians who were over a certain age not work in the COVID unit, pregnant people, same. We all decided together that we were going to be a team. So I do feel that healthcare workers have been very exposed throughout this, in a lot of good ways, right? A lot of cities were screaming out and thanking healthcare workers at 7 p.m. every night, which, when has that ever happened, right? Like, we all just work really hard and don't get a lot of recognition. So I do think that leverage of what we have been doing throughout this entire pandemic will come around, and there will be things that will help us. I think the negative effect is going to likely be fatigue. Like, people are really tired of this. Everyday people, all of us are tired of this, but I think in healthcare, I know I'm feeling fatigued. I know my nursing staff is feeling fatigued. So I think that will be something that maybe will come into fruition. I know one of my friends, their group decided to create a sabbatical for their physicians. So every certain number of years, each person gets like a few months off. So those type of creative things hopefully will come out of this fatigue. But I really do hope that healthcare workers will feel more of a sense of pride, and also leverage that, you know, we really do work hard, and we are part of a team. What do you guys think?
Yeah, I would completely agree with Megan. I think it's brought us together. I think we've developed resiliency together, which is, you know, I think in our individualistic society, I don't think that there's been a time where we've all shared an experience like this. And so I also tend to look at the positive, and I think, you know, there's so many things that are broken in our healthcare system. I think this has allowed us to really kind of expose all of those warts in a way that we haven't before. You know, even though we may have known that they were there, I think they've been exposed in a way that they haven't before. And so it's allowed us to kind of put mechanisms in place to really support one another, and support healthcare workers. And so, you know, Megan talked about, and my hospital has something similar, you know, putting together huddles where teams can come together. And, you know, even if we may not need kind of that, you know, acute psychological support in, you know, post-COVID, it may be a way to continue those huddles to really, for like team building. And so, you know, mechanisms that are now in place that just weren't before. I also agree with Megan that I think that the downside of this is going to be fatigue. I mean, I don't think that any one of us is kidding ourselves by thinking that people are going to leave healthcare because of this pandemic. And I think that is a travesty and a tragedy. And it is just so unfortunate. But I think that is going to be one of the consequences that we have to be prepared for. But you know, I think we can focus on more of the resiliency parts of the positive.
Yeah, and I agree with both of you. Focusing on resilience is extremely important. I like, Megan, what you mentioned about saying 3 things in the morning, well, I tell my patients, I recommend that actually, especially during these times that are so negative, to say 3 things that they are grateful for, and that's they really enjoy doing that. It has some positive effect on them. But Megan's comment also made me think of the veterans actually, and how the platoon, the dynamic that they develop in the platoon. It's a big protective factors, a psychological protective factor for them when they come back from the war. It's like the camaraderie that they develop, because they've faced such difficult things. They've faced death together. That becomes an amazing sort of resilient protective factor for them. Yeah, and that, I'm sure it's going to happen among the healthcare workers, the frontline.
Yeah, no, absolutely. I totally agree with that. And also just a comment too on Sejal, what you mentioned about people potentially leaving healthcare. I think also too, there's a lot of people who have been inspired by the pandemic also. And, you know, I was reading somewhere that applications to medical schools are up. I'm applying for a master's program in the public health sector because of what I've witnessed through the pandemic. So while I do think some people might feel burnout, I think there is also the positive of some people being inspired and really interested in creating change and hopefully avoiding something like this again.
Absolutely. It's such a good point.
Mm-hmm.
No, definitely. Great. And so I'll go on to another one of our questions here from the audience. So I have a question from Sue. I'll start with you, Sejal, on this one. So Sue asked that healthcare workers can feel like any lack of action or even the failures of policymakers to take a stronger action, and as well as the lack of adherence of the public to the proven health measures, such as wearing a mask. They might see that as a slap in the face, kind of offensive to healthcare workers. But what do you think is a good way to deal with this anger or resentment or a sense of futility that this might create?
Yeah. Susanna, it's such a good question, and thank you for asking it. I think it's, it's something that I know me and my colleagues have talked a lot about, feeling, just outright anger at just the response that we've seen, and really feeling kind of helpless in that, we know the science, and unfortunately, if things like wearing a mask are not adhered to, what does that mean for our society? What does that mean for us? What does that mean for our loved ones that are in danger? So it brings up a lot of emotions. I think, one of the things that my colleagues and I have talked about is, what can we do? We're few of us, I don't want to say none of us, but few of us are in a position to be able to kind of solve that entire issue, right? And so what part of it can we tackle? And so one of the things that we've done is in our hospital, we have a leadership group that signs up for kind of shifts to go around the hospital to really, talk to mostly visitors and patients about the importance of, these public health measures that are important, and really kind of educating people that are kind of our captive audience in the hospital to be able to kind of provide this kind of education campaign about why it's important to wear a mask. What does it mean? How long should I be washing my hands? What are the ways in which this virus is spread? And then debunking any myths. And now that the vaccine is out, we're incorporating that into the education as well, and what that means, and what the science behind it is, and also answering questions about just outright fear that exists. And so that has helped me kind of sublimate my anger into something that is a little bit more productive. But that's not to say that I remain frustrated and angry as well. So that's definitely there. But I can tell you that on a day-to-day basis, it has really helped me to say, okay, well, what can me as one person be able to do to kind of tackle some of this?
Yeah, definitely. Megan and Sandra, do you have anything you'd like to add?
Well, I've stepped in and as a regular practice, I ask all my patients, what are you doing to protect yourself? What are you doing to protect your family? And I also ask them, if the vaccine is offered to you, would you take it? And I do that with all my patients, and we have a discussion about that. And I do share with them that I was vaccinated, and the director of the clinic was vaccinated, the director of the hospital. And so it is important for them actually to know that. So that's another, like Sejal was saying, a way for me to feel like I'm doing something. Yeah.
I just want to say kudos to both you, Sejal and Sandra, for doing that education piece, because that is so huge. And you guys are both respected professionals. And I think that doing those things, and your hospital, Sejal, making a big effort that way is great. I'm going to bring that back to my hospital. I'll just say, for my own personal experience, when I get frustrated, I just think, yeah, what is the little thing that I can do? And sometimes I have a patient and I have to keep saying, please, sir, put on your mask. Please, sir, can you put on your mask? And I just try to think, you know what? It's okay. Like, just keep saying it and just keep saying it. So we will get through this together. And I think the anger is totally appropriate. And then hopefully as we work on it together and we find solutions, it will be less and less.
No, absolutely. I also have a similar question here from Sushma about also about healthcare workers and they're dealing with their emotions. I think there's a big sense of a lack of empowerment amongst healthcare workers. They don't have the protections that others are getting. a lot of our hospitals aren't having surveillance testing. There's a lack of physical distancing between colleagues. I think even there's that sort of pandemic fatigue, even among healthcare workers, that's sort of, leaving many feeling unempowered. And then I think also too, there's that fear of speaking up and, speaking up against your fellow physicians and asking, why aren't you doing this? Or why aren't you supporting this initiative? And I guess, so how do you combat that lack of empowerment and, kind of give the physicians strength and to get back and feel empowered again? And I'll start with Megan on that one, sorry.
Yeah, Sushma, I'm really feeling for you because from this comment, I feel that maybe you're in a situation where you don't have a lot of empowerment. And I have to say, just from my personal experience, I do feel that being in Utah, we were later to get the pandemic. And so our leadership in our hospital really learned from places on the East Coast, especially New York, that we needed to take care of our healthcare workers. So like PPE and being able to have people to staff, and even we hired a couple of extra people for the ER. So I feel that at least the leadership in my personal situation has been really good. But also remember, we had that whole community building and we talked as a group and we figured out what we needed to do. So I guess I would say, whoever you feel comfortable with in your current supervisor, so who's ever a supervisor of yours that you feel comfortable with, try to bring that up one-on-one, even one thing that you think would help your group, whatever it is. And then in that way, then you can have that person talk to the next person and the next person. And I think that that's the way that things are going to happen. As I mentioned previously, I do feel that hopefully the leverage of what we've been doing as healthcare workers will help this empowerment down the line. But as your comment suggests, there are so many different circumstances. And I feel fortunate to be in the one where I am, where I do feel my supervisors have our back. But if you're really in a situation that is unsafe for you, good luck, and really look around you and try to see who do you really trust that you can talk to try to feel that you're being heard, because you really should be. I mean, you're putting yourself on the line and you should be heard. I mean, that is absolutely something that I think you deserve.
Sejal and Sandra, do you guys have any comments as well?
Yeah, I would agree with that. I think, one of the things that that I've seen my colleagues do is get involved with, local organizations to be able to really kind of feel like their voice is being heard. And I do, I've seen kind of glimmers of that happening. I think, given that it's been on a, obviously a global stage, but in our country on a national stage of, healthcare workers have been put in this, untenable and horrible position. We do need to listen to them. So I think it is a ripe time to be able to do exactly what Megan's saying, and then also perhaps getting involved, right outside of healthcare within your community, and contacting a local representative to be able to talk. They listen to healthcare workers. I think we don't do much of it reaching out, but I would encourage you to do that, getting kind of doing some of that grassroots work.
Great point.
Yeah, so I agree with both of you. Leadership and advocacy are extremely important in times like these. Leadership especially is so important, and it can really curb the impact that something like COVID can have in the whole population. Yeah, there's so much I could say there about the way some governors handle the pandemic and how damaging some certain ways of handling it, whereas compared to others in this situation. Yeah.
Yeah, definitely. And I think we'll end on this question here from Taylor, which I think is a great kind of segue into a little more positive thinking, and the end of the pandemic hopefully is soon. But when things hopefully soon start to return to some kind of normal, whether it's that new normal or like it was before, what steps can we take to feel less anxious about that and also trust that things are going to be safe? Sandra, I'll start with you for that one, if you don't mind. Yeah.
Oh, sure. Yeah, I think that routines, as people mentioned here, routines are so important. And when we go back to more the new normal routines in a way, I think that people will gain more confidence. Also the interaction, contact, physical contact, also that will make us stronger. I think we all need that. I'm personally struggling with the Zoom and connecting with my patients via Zoom, even though I can see all the advantages. And also with my students, I can see all the advantages. But yeah, let me gather my thoughts more. I'd love to hear from Sejal and Megan, and then I'll share more ideas.
What I would add is that, we've been so focused on, lockdown and quarantine and, not having physical contact. I think that this is definitely a time to think, okay, that light at the end of the tunnel, although maybe a little dim still, is there. And so that's a really, really great thing. But I think we do need to focus our efforts on, that's also going to be hard, that we were forced to almost overnight to kind of be in this lockdown and, lack of kind of social gatherings and things like that. But the tail end of this is going to be drawn out. And I think we need to be comfortable with that. And also be comfortable with that each person's level of comfort is going to be different. And so, we know that once we get the vaccine, we should still be wearing masks. And, what that's going to mean kind of months from now when we do, let's say, hopefully, fingers crossed, months from now when we've achieved herd immunity, does that mean that we all one day overnight stop wearing masks? Probably not. I think it's really going to be dependent upon the science of the area that you live in, what your risk factors are, who you interact with, what type of work you do, what your social interactions are like, what types of groups you kind of spend time in. And so all of that is going to be driven by science. And I think, we can trust that there are, scientists that are working on this, just like the ones that miraculously developed a vaccine in such, record speed time. There are the scientists that are working on looking at the data and what is safe for us. But it's okay to be one of those people that are going to say, I think I'm actually going to wear a mask longer than what people are recommending or what my peers are doing because of my specific situation, whether it be kind of risk factors or just comfort level, and that it's okay to feel anxious. We have gone through, a very difficult, challenging time, and to say that overnight we're all supposed to feel comfortable with kind of a new normal or back to the old normal is unrealistic. And so it's okay to feel anxious, it's okay to feel scared, and all of those emotions are normal.
Yes, I agree too with Sandra and Sejal, and I echo Sejal that there's a lot of really smart people working on this, and I'm really just so thankful for that. One of the things in the beginning when I had a lot of anxiety, I did a couple of things. I told myself there's no zero risk in life, right? Like you walk out the street, you go in your car, there's no zero risk. So saying when I was walking into in clinical encounters in the beginning of the pandemic, nobody really knew. So I was really anxious about it. And then I would say, well, there's no zero risk. So I'm going to do everything that I can to keep myself safe, which was wearing a mask, doing the N95. And yeah, like I may wear that longer, or I may feel more comfortable doing this, but that hard line of like, there's no way to be perfect in this. So I'm not going to try. I'm going to do the best that I can with the information that these very smart people are providing. And then secondly, anxiety is really high right now. And personally, I have loved doing meditation to help me really let go. I do the Headspace app, and they were offering that free for healthcare workers for, I don't know if they still are, but that has been really helpful during the pandemic. So I'm going to continue to do that because I do think that the anxiety is real and it is a way for me to let it go.
Oh, Megan, I'm so glad that you mentioned that. So glad. So meditation and self-compassion, those are a winning combination. I encourage people to really use those every day. Meditation has been a lifesaver for many of my patients and for myself, actually. So thank you for bringing that up. Absolutely.
I totally agree. I use the Calm app, and I love it. I am one of those people that I think many people in healthcare can probably relate to this, that you feel like your mind is just constantly going. And so I was always one of those people that, you know, I can do yoga, but I'm like, meditation? I don't know. I don't think I could just kind of, quote, shut off like that. But really just following something that is kind of almost scripted feels just almost kind of, it's like it's on the to-do list, right? And so it feels like it fits into my life. And even if it's just, you know, a matter of like 5 minutes of deep breathing, that is meditation in itself. It doesn't have to be this, you reach this Zen place for 3 hours a day. You know, I think people have a lot of misconceptions about what meditation might be, but I have also found meditation to be incredibly helpful during this time. So I second that.
Awesome. All right. And I think with that, we're at our time limit right now. So I just want to take some time and thank all three of you for joining. It's been super insightful and informative to learn from the three of you about your perspectives on the pandemic and mental health. And I think everyone here can confidently say they learned something from all of you. So really, I appreciate it. And I hope you have a great rest of your day, and please stay safe. And I know what's happening on the news right now is super crazy, so let's try and, you know, use some of what we learned today and, you know, take that into the rest of the week. But yeah, no, thank you so much.
Thank you all.
Thanks everyone for joining.
Thank you guys. It's been so fun.
Absolutely.
Yeah, it was a pleasure. Thank you.
Take care, everyone.